Hi, I'm Trevor. You've probably started watching this because you've been told by your osteopath that you have a pelvic torsion, and that's the reason for your back pain or sciatic pain or stiffness. And I just want to explain a bit about what the pelvic torsion is. So when we say you've got a pelvic torsion, it means your pelvis is rotated either to the left or to the right. In practice, we tend to find they more often go to the left, and no scientist has yet proved as to why that happens. It's just what we observe in practice. Reasons for torsion: it can be purely from muscular imbalances. For example, if you've been raking in the garden or you have a habit of sitting with one leg crossed over the other, that can set up muscular imbalances which pull the pelvis in that direction. Other reasons for pelvic torsion can be from either a trauma where one side of the pelvis is impacted. For example, if you fall onto your bottom, it can actually move the sacroiliac joint, causing what's called a subluxed sacroiliac joint, easy for me to say. And that means that the joint is only a few millimetres, but it's slipped out of its regular alignment, which causes all sorts of confusion to the nervous system, micro tears within the ligaments, spasms within the muscles, and usually nerves that get quite irritated along the way as well. So if you have this, the osteopath will try to use his techniques or her techniques to realign the pelvis back to a neutral, happy position. Our protocols are neutralise, that means to get the pelvis in the right place or the body in the right place. Then to stabilise, that's the really important bit, to keep the pelvis from moving back to its painful position again. And then after we've done that is then to strengthen and mobilise so that you can do all manner of sports and things and not worry about this twist happening again. So coming up soon will be Joe telling us 3 stages of rehabilitation exercises to neutralise and stabilise and then strengthen and mobilise a pelvic torsion so that you don't need to have the osteopath to realign the pelvis with a manual treatment too often. We don't like that. So once again, just looking at the pelvis, it can have a torsion, which means it rotates around an axis, can be muscular from habits, it can be a joint slippage from a trauma or from unfortunate vectoring, doing things like bending forwards and twisting to undo the dishwasher. That can do it as well, things as simple as that. So I hope that explains things, and we'll go on to learn about some exercises to help you at home. So how do we arrive at the decision that you've actually got a pelvic torsion? I'll show you. We'll get rid of this one, and I'll bring a live one in the form of my wife Jo.
Ta-da!
So you may have done this with the osteopath or with a Pilates teacher, but what we're doing when we look is we put our hands over the top of the pelvis, which is over these iliac crests here. So I feel here, I get an impression as, is one gone forward, has one gone back? And it's quite obvious once you've been feeling these for a few years, it's quite easy to see. I'll put my thumbs in the sacroiliac joints in here, and then I'll look at, is one high, is one low? I get an impression of which way I feel the pelvis is twisted. Then I might ask Jo to roll forwards, and then my thumbs will follow the movement. And as we can see there, the right thumb is lifting up quite clearly. So that shows me that the right side has gone forwards. And then I might examine what the sacrum's doing by pushing down here, and I'll ask you to roll forward again, please, Jo. And then again, we can see the left thumb is coming up. So I know that there's a bit of a row going on between these pelvic bones here. I need to know, are these joints moving? They should move, just a little bit, but there should be some movement. So I'll ask Jo to raise her right knee, and if you watch my thumbs, you'll see my thumb drops away on this side. So as Jo did that, I was holding here and here, and it dropped away to show me the joint is actually moving. We'll check it on the left side as well. So again, if you can lift the knee for me. And we've got some movement, but not quite so much. And if I could ask Jo to bend to her left, and to her right, and back to the middle, and maybe a rotation around. I'm looking to see which is the preferred way of movement, and Jo likes to rotate towards the left. So I want to clinically screen and make sure there's nothing else going on, like a disc or trapped nerve in there, because pelvic torsions can be sore enough. but other things can happen as well. So we'll just do a couple of movement screens. Joe, if you could have a sit on the table for me. And then the slump test is where I'll ask the patient just to slump forwards. This puts pressure onto the discs. And then I'll ask Joe to extend out one leg with the toes flexed. That stretches the sciatic nerve. If it's caught on one side, you have like a trapped nerve. If it refers neurological sensations to the opposite leg, then I can be thinking that it might be a disc that's the problem, because with a pelvic torsion, it puts the disc under more stress. Then if you have a lie there on your back for me, please, Joe. The straight leg raising test is where, literally, we take the legs that are straight and we raise them up. In a normal test, we should just get some tension in the calf and the hamstring. But if Joe's got some trapped nerves in there, then she's going to feel some discomfort in her back as I lift and stretch the sciatic nerve. If she feels the point where there's pain, I ask her to push down into here to create some pressure, and that relieves the pain. Then again, I'm sure it's just a mechanical discomfort that's causing that pain from there. So that's the straight leg raising test. You can do it yourself at home by putting your foot into a band or a scarf and then holding onto it and pulling it up yourself. Again, you can test it yourself at home doing that to know if the exercise is working, if you're feeling better. Okay? That's how we look for a pelvic torsion. So once we've established there's a pelvic torsion that we're going to need to fix, this is a method that we might use to fix it. There's lots of different ways of doing it, but here's a popular one we do at Bridgham. My aim of treatment is to take the pelvis from its torsion state and then move it back to neutral from here. So what I'm going to do is to stretch the muscles at the back of one side, the front of the other side, activate the muscles at the back of that side and the front of that side, and then make an adjustment just to bring the pelvis back to where it should be from there and take the pain away, hopefully. So, I'm going to stretch the piriformis muscle, which is behind Joe's left bottom over here. I might hold this for 30 seconds or so, asking Joe to push against me and release. Then I'm going to stretch the front of Joe's right hip. I'm going to bring her to the edge of the couch, stabilise her lumbar spine and pelvis by getting her to push against me, and then stretch the right hip flexor muscle here, so you'll feel me stretching down the front of the leg, like so. And then from there, we're going to then activate the opposite muscle groups. So I'll weave my arm through and ask Joe to try and break my arm. So try and break my arm, Joe. She's a strong lass. Can you put your hands by your sides, engage your lats muscles, push down into the table and lift. Good. I'm now going to try and push Joe off the table and she's going to resist me. And then relax. Super. Then I'll ask Joe to lie on her side and face towards the mirror. And again, we're going to activate those muscles. So right leg's up, left leg is long. Got a wild one here. I'm going to ask Joe to push me here and block me here. So she's squeezing me like a tube of toothpaste or like a James Bond spy, crushing me in the middle there. So I'm squeezing her to get the activation of the back of the right side and the front of the left side. That's helping to pull that pelvis around. And relax for me. If I need to make an adjustment into the joint directly, I'll then from there gently pull Joe into a position where I can feel tension mounting in the joint. I'll ask her to hold her wrist and I've got her safely on the table as I then bring the leg around and use my arms and body weight to just gently give it a little nudge to free the pelvis back where it's supposed to be. How do you feel now, Joe? Fantastic?
Fantastic.
Hand on me here. Let's sit you up. And what we do afterwards is to retest. Always retest. So if you can stand for me, Joe. I then go through the same bit of looking what is where. Ask Joe to roll forwards and hopefully see a nice even flare. It has actually got better. And repeat the stalk test. Good. And the other side. Everything's moving beautifully. So what we now need to do is stabilise it, and that's the fun bit. So you might see us in clinic get out the foam roller, do some exercise with that, or other all mean of things to do to get the pelvis to stabilise. Okay?